Meet Stl'atl'imx elder Gary Oleman, a survivor of residential schools and substance abuse. He's now helping others in Vancouver hospitals as a community support worker with his songs and words, part of the Aboriginal healing tradition. He's seen stark examples of discrimination faced by First Nations, Inuit, and Métis people in the urban healthcare system. Gary remembers the words of a mother from the Queen Charlotte Islands who came to Vancouver with a high-risk pregnancy.
She had tears in her eyes and she says, I just met with the doctor. As he was reading my chart, and I have 2 other children, I have three children now. He's reading my chart and he said in such a rude manner about me having the same father for all my children. And she was just so hurt, being accused of being a loose woman. She was stereotyped as a person with low morals or whatever by this doctor. A highly trained professional.
Across the mountains in Portage La Prairie, Manitoba, there's a program underway like many others in Canada that's improving cultural communication and trust between Aboriginal people and the healthcare system. Doretta Harris is Regional Director of Aboriginal Health Services in Manitoba's Southern Regional Health Authority. What got the program started?
Aboriginal Health Services was needed because there was not anything in place before in our current health system that would really have meaning and be matched to the needs of Aboriginal peoples. Culture needs to be part of the health system today, and it needs to be intertwined in our everyday health practices with all the health practitioners, because culture is a part of that person.
That's important because many Aboriginal people don't use mainstream healthcare services. They don't feel safe from stereotyping or racism. Rather, they feel a sense of alienation and intimidation from Western healthcare. Norma Goulet is one of the Aboriginal support workers here. Her challenge as an intermediary is to put the program's policy into practice by navigating the cultural gaps to make Aboriginal patients feel welcome and confident in the healthcare system.
I think the most important thing is communication between the patient and the doctor. The doctors usually will ask me the questions and I'll interpret and ask the patients, and then I'll interpret English to doctors.
What's the impact on the frontline medical staff here in Portage La Prairie?
I think we find with this kind of interaction with this support group, people are more open to discuss medical issues that otherwise we won't be able to know.
What about the Aboriginal patients? Caroline Bolio, originally from the Sandy Bay Ojibwe First Nation in southern Manitoba, speaks Ojibwe as her mother tongue. She comes to the hospital 3 times a week for dialysis. Knowing she can depend on Norma makes a big difference.
It's good, I can understand more like that than English. It's better to speak in your own language than your own, like other languages.
Dr. Catherine Cook is Manitoba Métis and a counsellor with the Health Council of Canada.
Well, having access to Aboriginal support workers like Norma within the Canadian healthcare system is really important in reaching out to Aboriginal peoples. There's a lot more that needs to be done. Programs like the one that they have in Portage La Prairie are one way that the healthcare system can reach out to Aboriginal people, improving not only the quality of health care that is received, but ultimately improving health. It's a way of showing respect, a recognition of the importance of culture in health, and reaching towards reconciliation within the community.
To learn more about programs like the one in Portage La Prairie, or to read the Health Council's report on cultural understanding, empathy, dignity, and respect, creating cultural safety for Aboriginal people in urban healthcare, visit our website, healthcouncilcanada.ca/pub/urban-aboriginal-health.
Ah, thank you, brother.